Hello scholars, my name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the subscribe button and don't forget to like this video. That way I can keep producing the videos that you like best. In the last video we covered dissociative amnesia, and in this video we're going to cover depersonalization and derealization disorder. So let's begin. In order for someone to be diagnosed with depersonalization or derealization disorder, they have to have the following symptoms. A. The individual will have continuous or reoccurring experiences with depersonalization, derealization, or both. Now, depersonalization means a feeling of detachment from oneself or one's feelings within one's own body. The person might not feel their thoughts, their sensations, their body. They might not feel their emotions or the actions that they take. They may perceive things differently than others. They may not see time the same as others do, or they'll have or complain about an emotional numbness. Derealization means feeling a detachment from the world around oneself or with society. Individuals may feel like the items around them are not real, or they're not seeing them the same that other people see them, and they may see things as kind of unreal or may interpret them as dreamlike or foggy. B. While the person is experiencing depersonalization or derealization, they can still check themselves to make sure that they are real, and this is kind of a normal process that a person with depersonalization or derealization or both will go through. An example might be like pinching oneself to make sure that you're real, or asking others around you if they see or hear the same things that you are hearing or the individual is hearing. C. When a person is experiencing symptoms, they'll say that they're experiencing distress, whether it's in relationships, at the workplace, or in an academic setting. They've got to show some distress about the depersonalization or derealization. D. The person is not having these symptoms because of a medication or drug that they're taking. E. The symptoms are not better understood given a different mental disorder such as panic disorder, major depressive disorder, PTSD, acute stress disorder, or schizophrenia. When a person has depersonalization or derealization disorder, they feel apart from an aspect of themselves or several aspects of themselves. The individual may feel separated from their feelings, sensations, thoughts, certain body parts, or their whole body. Persons with the disorder have stated that they feel like a robot and that they can't control their movements or the agency of themselves. Individuals with the disorder also state there is a part of themselves that goes along with society and another part that completely stays separated from it. These situations have often been called out-of-body experiences. Having this disorder can also mean not experiencing one's feelings or having a sensation of numbness. Those that have derealization disorder often feel separated from the world around them. They may feel that their experiences with other people, their surroundings, or their interaction with objects is not real. Persons have described feeling as though they are in a dream or a fog of sorts. They may also describe the experience as living in a bubble or being behind a pane of glass. Those individuals that have experienced derealization disorder might describe their interactions with the world as lifeless, artificial, or even colorless. Persons may experience blurriness, an increase or decrease in what an individual can see. They may experience the world as 2D or with more dimensions than what other individuals may encounter, and sounds can either be heightened or they might feel like they're muted, that they can't hear them, or it sounds more like wah 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 wah, kind of like the Charlie Brown thing. When asked about their symptoms, individuals with depersonalization or derealization disorder have difficulty describing what they're experiencing. They may state that they feel like they're going crazy. They may fear that they have brain damage or that time is off compared to what it has been in the past. The individual might also feel lightheaded. They might have tingling in their body, or that their head feels extremely full. Persons might continuously check reality or find themselves obsessing over whether or not they are real or the environment around them is real. It is normal for an individual with depersonalization or derealization disorder to have depression and anxiety. About 1/2 of all adults have experienced at least one lifetime episode of depersonalization or derealization. Only 2% of the population experience depersonalization or derealization disorder within their lifetime. The average age of onset of the disorder is 16 years old, but individuals can experience this at 13 to 14 years old. 1 out of every 5 persons will experience the disorder after 20 years old. The episodes in which a person experiences this disorder have been brief, or can be brief, from hours to days, to much longer, weeks, months, or even years. If an individual experiences this disorder after the age of 40, it is important to have a medical examination to make sure it isn't a health condition or medications that are triggering these symptoms. Episodes can be triggered with anxiety, stress, mood changes, overstimulating environments, or even a lack of sleep. Individuals that tend to get the disorder often have experienced some sort of trauma in their childhood. Those who have experienced emotional abuse or emotional neglect are more likely to suffer from symptoms. Those that are at a higher risk of developing the disorder are those that have seen domestic abuse in their home, have had a parent that is mentally ill, have encountered physical abuse, or the suicide of a family member or friend. Illicit drug use can also pose a higher risk of the person suffering from the disorder. Hallucinations, MDMA, ketamine, marijuana, and salvia can bring about the symptoms of the disorder. If a person is experiencing the symptoms of derealization or depersonalization disorder through meditation, this should not be seen as a representative of the disorder. With meditation, persons are often intent on inducing these experiences. For those individuals that are experiencing the disorder, how they present on the outside is going to be much different from how they are feeling on the inside. Even though some individuals may represent robotic-like or solemn, they tend to be experiencing quite a bit of emotional pain on the inside. It's also very common for an individual that is experiencing depersonalization or derealization disorder to be diagnosed with unipolar depression. They can also be seen with avoidant personality disorder, borderline personality disorder, and obsessive compulsive personality disorder. All right, well, that is the end of our video. Thank you so much for being a part of this channel. It really humbles me in so many ways. Thank you so much, and I will talk with you soon.